Hola, audience. Here's a question of the day. True or false? Social workers can work as a therapist. The answer will be at the end of the episode. Hey y'all, I hope you're well. Welcome to another episode of Healthcare Boulevard. This is a podcast where we shine more light on healthcare, and our goal here is to provide more options to people looking to choose healthcare as a career path, regardless of their background. My name is Sena Kakpomo, and I am your host and creator here. I thank you for tuning in. I appreciate your support. Remember, you can tune in on YouTube or wherever you get your podcasts. Without further ado, let's get into today's episode. Welcome back, audience. I am your host, Sena Kakpomo. I am here with Jasmine today. She's a social worker. I'm excited to talk with her. Jasmine, welcome. How you doing?
Hi, thank you for having me.
Of course, of course. Go ahead and tell us a little bit about yourself.
Yeah, so I'm a licensed clinical social worker in the state of California. I founded CSULA Counseling Center in Arcadia.
Wow, that's amazing. Okay, so you're working in your own practice. Is that correct?
Yes,
Okay. So how long have you been a social worker?
I've been a social worker, I want to say since 2008 was probably my first internship. I received my bachelor's in social work from Cal State LA in 2010, and I went on to get my master's in social work in 2011.
Mm-hmm.
And I've been working as a therapist post grad since 2011.
Wow. Okay. So I social work is one of those of social workers. That title itself like a lot of titles in healthcare encompasses so many different avenues you can take. It by itself, it's a boulevard, right? It has so many different things you can do with it.
Yes.
Now, you mentioned you got your bachelor's degree in social work. What did you do thereafter? What type of position did you held thereafter?
Yeah, so you're right. Social work, you want to look at that like a tree. There's just so many branches and avenues that you do want to go into. And so the first line of social work would be at the bachelor level. So students that have graduated with their bachelor's degree in social work can get positions like family advocacy, case management, and quite honestly, it's so broad. Our field is so broad that you can actually go into community organizing, activism. You can go into the healthcare industry, work in hospitals or work in outpatient settings. You can also work in mental health.
Mm-hmm.
And so then the next level of social work would be the master level of social work. And then at that level, you would look more into the clinical fields or into administrative positions.
Okay. And so after your bachelor's degree, how long thereafter did you work or prepare for your master's degree?
Quite interestingly, I got accepted right after I graduated from my
Yeah.
bachelor's. So the only experience I had at a bachelor level was an internship that I did at 1736 Family Crisis Center. I was a case manager intern at a DV shelter. I was working with women and children that were victims of domestic violence in a
Mm-hmm.
residential
Mm-hmm.
facility. And so that was definitely my first exposure as a social worker.
Mm-hmm.
Prior to that, I had other volunteer and internship experiences that are very familiar to social work, but it wasn't labeled social work. And it included working or volunteering for organizations. At the time, it was called LACAW. I believe today it's Peace Over Violence.
Okay.
And also working through my community college at the time. This was probably back in 2005, I want to guess, at Glendale Community College. I was part of a program that was called STAR, and they trained us to speak to high school students about racism and stereotypes, things like that. So that was probably like my first exposure, but it wasn't any official titles of social work, but it was definitely within the field. And then right after I graduated, I applied towards my master's degree program and I actually got accepted into the advanced standing program. So I did my
Mm.
master's in 10 months.
Wow.
And the
Okay.
internship experience that I had there as a clinical therapist was for Azusa Pacific University's Community Counseling Center. So it's an outpatient program. And so I was, half of my caseload, I was seeing members of the community, adults and children that would come to the center that had all kinds of problems.
Mm.
And I was also placed at an elementary school, and so I was seeing students from kindergarten to the fifth grade that also
Mm.
had some mental health problems.
Okay. So it's interesting that now before you have your own company that you're working with right now.
Now I do,
Before
yeah.
that, yes, before that, did you work, I assume you work with other companies as an employee. Is that correct?
Yes, post graduate. So after I got my master's degree, I went on to work for an outpatient psychiatric facility
Mhm.
in South LA. Yeah, it was called Los Angeles Child Guidance Clinic.
Okay.
And so I was working there, accumulating my hours to become a licensed clinical social worker. And so when you graduate with your master's degree in social work, you want to go ahead and apply to become registered with the state of California through the Board
Mhm.
of Behavioral Sciences. And once you are registered, you're able to accumulate hours and you work under supervision. And so I was working there maybe about 3 years.
Mhm.
While I was there, I was also serving same population, children and adults that had problems with depression, trauma, anxiety, and all kinds of personality problems as well.
Mhm. So it's interesting to me, the sort of the intersection between social workers and then psychiatrists versus or psychologists, because as
Mhm.
social workers, and I've heard from people in your aisle, and you just mentioned it yourself, you can work as a therapist to some degree, or to a very significant degree. And then of course we know when we think therapist, a lot
Mhm.
of us think, at least I do, psychiatrist or psychologist,
Mhm.
right? So, what is the difference between how a psychiatrist or a psychologist may practice as a therapist, and
Mhm.
how you may practice as a therapist with a social work background?
That's an excellent question. We get asked that question all the time because when you're thinking
Yeah.
social work, I want to say that the majority of the people are automatically going to think Child Protective Services.
Hmm.
They're
Hmm.
going to think the Department of Children and Family Services. And so we do so much more. We're trained so much more than that. And so this is an area in your master's degree where you specialize. And so I went into the clinical field.
Gotcha.
And so that's how I got the training in mental health. And so the field of mental health is very, very broad because you
Hmm.
have all kinds of professionals. You have a marriage and family therapist, you have professional counselors, you have a psychologist, you have clinical social workers like myself, and you have psychiatry. And so again, you want to picture a tree with a lot of different branches. We all have very similar trainings, but do very, very different things.
Hmm.
Um,
Hmm.
so for a marriage and family therapist, similar like the social worker, you get your bachelor's degree in psychology, and then you get your master's degree in marriage and family therapy. And so the difference between a marriage and family therapist and a social worker, even though we are both in the field of mental health, marriage and family therapist focuses more on mental health relationships, right? And
Hmm.
then in the field of social work, we're looking at systems, how the person functions in a system. And so then you have a psychologist or a PsyD, which they have the same route as someone similar to the marriage and family therapy. They get their master's in psychology, but then they move on to get their doctorate degree, either a clinical route or a researcher route
Hmm.
in psychology. And so a psychologist can also provide therapy, mental health services, but they also do assessments,
Hmm.
which at a master level, an LCSW or an LMFT cannot do those
Hmm.
types of assessments. And then you have a psychiatrist. A psychiatrist is a medical doctor who prescribes medication regarding mental illness.
Yeah. Well, you know what? I appreciate you for going, and really summing that up for those of us who may be ignorant or unaware of all the differences. So I thank you for that. And so right now, what is your setting in your company? What's your setting? What type of patients are you seeing, and what are you helping them with?
Mhm. So I chose right after I got licensed to go in private practice.
Mm,
I really like the flexibility being in private practice with my time and my schedule, and I also get to focus on the population that's my niche. And so here in Arcadia, we have adult mental health and also for children. So pretty much any male or female that struggles with a mood disorder, which that would include depression, anxiety, bipolar disorder, trauma.
okay. And so when your patients are coming to you, I'm trying to better envision and give a better vision to our listeners. So are you the therapist that we see when we think therapist in our head, where you're sitting in the couch, you're like, come on, join my couch, and you talk to them. Is am I right?
Yes, traditional psychotherapy, yes.
Okay, okay.
so So when a client or a referral contacts our office, I have a group practice. So we have an intake coordinator, and there are other clinicians that also work for CSULA Counseling Center. And so where a referral contacts our office, they go through the intake process, and then they get connected to a therapist that best fits the issue that they are discussing or
Mm-hmm.
that they're coming into therapy for. And so we all have different backgrounds and different type of trainings. Like there's also we have hired an LMFT, we have hired an LCSW. We provide therapy in Spanish. We also provide therapy in Korean and
Mm,
obviously in English.
right.
And so then they'll have obviously our office information, and they'll come in, they'll check in with the receptionist, and then the therapist, would come out and greet them. We come into our office, and so, yes, you will see the traditional couch and the therapist chair and
Mm-hmm.
interventions and just tools that we use and utilize in therapy. When we're working with children, our offices look like playrooms
Mm-hmm.
because the processing of thoughts and feelings or trauma or whatever issue the child is coming in, it's going to be through play, it's going to be through art activities. So it looks like a very fun room, very colorful.
Yeah.
And that's just to help the child have a positive experience in therapy.
Mm-hmm.
For we also have offices for our families, that are a little bit more larger to be able to facilitate obviously family therapy. And then we have
Mm-hmm.
our adult room, which is your traditional, your couch and your chair, the therapist
Yeah.
chair.
Yes.
Uh,
Yes. And so going back a little bit on your education, so when you're done with your master's degree and you completed the master's degree, you get your certification and then go into doing your hours, or do you do your hours then get your certification? What's the
the
pattern for
road,
that?
yeah.
Mm-hmm.
So
Yeah.
after you get your graduate degree, you register as an associate with the California Board of Behavioral Sciences. And so they require a lot of information like your degree and your transcripts,
Mm-hmm.
background check. They also ask for just a lot of detailed information. And then once your application gets approved, then you are able to work as a clinician in the field of social work. I believe in other fields that do not require any clinical work, you do not need to be registered with the California Board of Behavioral Sciences, like, for example, any case management work, or if you work for children and family, child protective services.
Mm-hmm.
But if you do go into the clinical field like I have, you do have to be registered with the state to do clinical work. And they give you a registration number, almost like a
Mm-hmm.
license number, a registration number. And so
Yeah.
then you're able to provide under supervision of somebody who's already licensed. So I was licensed. I'm sorry, I was an associate social worker. That's what you would be labeled as. And so I was accumulating, I think it maxes out about 40 hours a week.
Mm-hmm.
And the board at that time, when I was accumulating my hours, I want to say it was maybe about 3,200 hours before you're able to send another application to the board and request to come to do your licensing exam. So
Okay.
in within those hours, they do have categories. For example, the number of hours that you have to do that are clinical, and that would be your face-to-face, like your actual therapy, and you have your supervisor sign off on those hours that were completed. You also have consultation hours, documentation hours,
Mm-hmm.
reporting hours. So it's a lot.
Right,
Um,
right. I
so
imagine
it's
so.
about, I want to say about, if you work a full-time job, the 40 hours a week, it would probably be about 2.5 years
Mm-hmm.
of work that you do, being super under someone else's supervision. And
Mm-hmm.
then you go ahead and you study for your licensure exam, and you go and you take your exams and you pass, and you apply for a license number once you pass your exam. And then once you have your licensure, then you don't have to be supervised anymore, and you are able to go into like myself, I went into private practice.
Mm-hmm. Mm-hmm. Okay. Well, thank you for that. And so you mentioned earlier you see a range of patients in terms of age, right?
Yes.
What are some, and I'm more interested in the children,
Mhm.
and that's more of a personal interest, so to speak, is what are some challenges you've seen being and seeing patients who are children dealing with mental health and trying to work them through it versus an adult with the same problem?
Um, with children, I want to say it would be just the system,
Mm,
making sure that the system doesn't fail them.
mm.
So I want to say the challenges. Are you speaking like in general, or like personal challenges
No, just
that
in
I've had?
general.
Just in general.
Mm-hmm.
I would say just making the resources available for kids, because
Mm,
when kids obviously they're in school, and so it would require them to, go to an office after school, or just trying to schedule, at least in a private practice setting,
mm,
the hours to work for children's mental health would be in the afternoons after they come out from school. In community mental health, it's actually a lot more easier for nonprofits or the Department of Mental Health, because a therapist has the ability to be able to go to the school or to the child's home to provide mental health services, which, quite honestly, I think that's probably the most effective
mm,
in doing mental health, to be able to do intervention in the child's setting as opposed
mm-hmm.
to them processing in an office. So I think it just kind of depends on the case.
Okay. And so community mental health will be what, how we defining community mental health? Is that governmental or like something that's associated with school or some institution?
Community mental health would just be the nonprofit
Okay. Okay.
versus private
Gotcha.
practice.
Gotcha.
Yeah.
Okay. And so we talk about the kids. Now, what is some, just in general, some challenges you face as a social worker being in the field for as long as you have?
Challenges with children.
No, just
Uh,
in general. Just.
in general,
Mhm.
um, challenges in the field of mental health. Again, I think it would be more systemic.
Yeah.
Like, for example, making mental health affordable for the community. Another
Mhm.
challenge would be when someone has insurance and they want to use their health insurance. A challenge that we definitely find ourselves is trying to get approval from the insurance for certain services. I have definitely gotten frustrated in the past where I had patients, I'm the therapist, I'm the one doing the intake assessment and the diagnosis and the treatment. And so I'm
Mhm.
giving these recommendations on how this person's able to heal. And so when we submit the claims to the health insurance, it turns out that they're not allowed to have 1 hour of therapy. They could only do 30 minutes of therapy, because according
Mm.
to the health insurance, they're saying that the issue that the person is experiencing doesn't require 1 hour
Mm.
therapy. And so that's kind of difficult. And I start to question just assist the healthcare system when it comes to contracting with health insurances.
Yeah, yeah. And what are some of your favorite things about or favorite parts about being a social worker, especially in your field?
Helping people.
Yeah.
Definitely helping people, just the reward, it's like life. We're on this journey where we hit adversaries, and it's life can get really hard sometimes, and I really enjoy helping others just try to navigate, and just be able to provide that support and healing, a
Yeah,
lot of
yeah.
internal healing.
Yeah, yeah, it's definitely important. And how is your work-life balance, especially as the owner of your practice and the practitioner and the whole nine yard?
Yeah, it's definitely a full-time job.
Yeah, yeah,
Having my clinical hat, my administrative hat, and also, being a single mom. So it definitely takes a village to be able to have that support to be able to raise my son.
mm,
So I definitely appreciate my family for the help and my
mm-hmm.
friends for the help in that area. And so in private practice, actually, that's the reason why I went into private practice, because I wanted the flexibility to be
Mm-hmm.
able to have a life balance where I don't have to ask somebody, for a day off or sick day or things like that when I have to spend,
Yeah,
some time with my son.
yeah, I love it. And what are some growth and leadership opportunities in your field?
um just continuing education, just keep moving on, getting, there's so many opportunities for training, so many different specialties.
Mm-hmm.
So it just depends on what the person wants to focus on. There's always training opportunities, and obviously, if you want to continue your education on moving on to the doctorate level.
Yeah. And now, you've been a social worker for how long now?
um After my master's degree, since
Yeah.
2011.
Okay. All right. So it's been 10 years. I'm always interested to see any changes that happen in, especially healthcare field. Have you noticed were there any major changes, especially us going through COVID? Of course, that's it. That was a big one. Anything besides that or incorporating that was a big major shift or change in your field?
Definitely, I appreciate that the nation has targeted the stigma of mental health.
Mm.
And so now mental health is more normalized. It's more, I can see more advocacy and people being encouraged to have a therapist where, before that, as a student, I would just see so much the stigma on mental health, especially in the Latino community. I'm a Latina. So in
Mm-hmm.
the Latino community and also within my faith as well, there's also that stigma,
Yeah.
oh, you don't go to a therapist because that's only for crazy people. And that is a
Mm-hmm.
lie.
Or just
No.
pray on it.
Yes, exactly. And I'm an advocate of the integration,
Mm-hmm.
of your culture and your beliefs and psychology,
Mm-hmm.
and
Mm-hmm.
just get the positive things of everything and try to make it work to help the person function. And
Mm-hmm.
so, and the shift that I've seen in the last 10 years is that now mental health, I can see that in politics, from like the White House, that they're trying to have more funding for mental health. And so I've also seen throughout uh, the school districts, where they now have wellness centers in the schools, where if there's a student that's experiencing something, like they have resources within the school to be able to get connected
Mm-hmm.
to mental health. So that's definitely a growth that I've seen. Also just the integration of our fields. When there is a medical clinic, there's also that behavioral health department.
Mm-hmm.
So we can definitely see a relationship with other professionals as well.
Right, right. And for you, I know we talk about your education at your master's degree level. Does your field, especially clinical social work, has the option for a doctorate or PhD level if one so chooses?
Yes, it's the
Okay.
DSW, so it's the doctorate in social work. So
Not
if you
the
want,
shoe company.
no, not the designer shoe warehouse. I do like shopping there though.
Anyway, I was just too crazy.
That's a good one. Yeah, the DSW, the Doctor of Social Work.
Gotcha.
Yeah, so
And then
if you
you
want
can
to continue, yeah, if you want to continue within the social work branch, you have the Doctor of Social Work. If you want to continue just within the field of psychology or whatever other specialties, then there are other options as well. And so I chose to continue my education, and I'm started a course in the program is a Doctor of Education in Community Care and Counseling with a specialty in pastoral counseling. And so I'm specializing in the integration of theology and psychology. So the population that I'm serving would be people within the faith community for mental health. So specifically, it would be Christian counseling.
Wow. So is that, you said pastoral?
Pastoral.
Oh, pastoral. Okay, gotcha. Like a pastor.
Pastoral counseling.
Gotcha. Oh, wow, that's pretty cool. So once you're at your level, you can choose to get your PhD in anything that sort of really vibes with how you're trying to move forward with your education and your profession, correct?
Yes.
You're not limited to clinical psychology. Social work. Okay.
Yeah. So whatever specialty it is that you have your interest in. So it can be if you want to continue in trauma, or if you want to continue in social work, or if you want to branch out and also get your doctorate in psychology. But within the licensing, within the state of California, the license in clinical social work would be the end of it.
Right. Okay, that's really cool. Thank you so much. Lastly, before I let you go, any word of advice for aspiring social workers?
Yeah. Just if you're going to school, go to school full time, and just accumulate your hours and get licensed and just follow your passions.
Yeah, I love that. Well, Jasmine, thank you so much for joining me on this very now sunny Friday that we're having over here in Cali. I appreciate that. And thank you for shedding more light on your profession. Always love learning about the other aisle in healthcare. So really thank you. Before I let you go, how and where can people find you and your company?
Yes, you can definitely visit our website at www.selacounselingcenter.com. That is SELAH. Or you can contact our office at 626-515-4202.
Thank you again. And I appreciate all the work that you are doing with mental health. And have a beautiful evening.
Thank you. You too. Thank you for having me.
Of course. Bye.
Yes, you've heard it throughout the episode, as our guest actually works as a therapist. So you know the answer is true. And so thank you again for joining. Thank you to my guests for being here and taking the time. Not just Jasmine, but everybody that came before her. I really, truly appreciate y'all for sharing your experience and part of your journey with us on this podcast. All right, stay safe and be good to yourselves. Bye. All right, that's all I have for you today. Thank you again for joining me. I appreciate you. Please subscribe, follow, like, comment, and share. And stay blessed. Bye.